Hello, my name is Nora Riley, and today we will be taking you through a demonstration of Cerner's ambulatory solutions. We'll begin our visit utilizing Cerner's practice management solution. We'll go through a registration and scheduling of a patient. After that, we will see a patient from the provider's standpoint. We'll utilize both our PowerChart Touch native application and the desktop version so you can see how to utilize both a mobile application and a desktop version hand in hand throughout your visits. We'll complete that entire visit, and afterwards we will go through a couple items that would happen in between and after visits, including a couple of tools utilized to manage an entire population. And lastly, we'll follow up with checking out our patient and running through the patient accounting piece. Let's get started. So we'll begin here in Cerner Practice Management. This is going to be the home screen upon logging in. As you can see, I am logged in as a manager, so along the left-hand side I do have access to all the toolbars needed. But for instance, if maybe you were just in charge of registration or scheduling, you may only have access to those top three icons. What you're seeing here is we are viewing one particular provider's schedule for today. Of course, we also have the ability to look at multiple providers' schedules within one pane. And lastly, we also have the ability to look at one particular provider's schedule, stretch it across multiple days so you can see what the rest of the remaining week will look like. Now, if you look in the lower left-hand corner, there's always going to be a calendar that follows you around, so if you ever need to jump forward a day or back a day, you can do so. This next tab is going to be my availability view, which is mostly used at administration level. This allows you to stack multiple provider schedules, one on top of the other. It's going to put those schedules in a heat map look so you can determine who has availability throughout your practice. Now, the darker the colors is going to indicate more patients at that time. The lighter the color will indicate more availability. So if I hover over Dr. Riling's schedule at the 8 o'clock hour, she has 0% availability, but at 9 o'clock she does have 25% availability. Let's hop directly back into her schedule. It'll take me directly to that slot where she does have time. Now, as we are talking about slots, you'll notice that Dr. Riling has hers organized where she does see multiple types of patients throughout the day. These slot setups can be built at the individual provider level, determining what types of patients they like to see at what times of the day. So looking at Dr. Riling's schedule, it looks like she does have some free time in the 9 o'clock hour, which, lucky for us, a patient, Vicki Jackford, just calls in and needs an appointment for today. We can quickly begin to add that appointment here. You'll notice as I search for the patient, there's multiple search options on the left-hand side. So within your practice, if you're searching by birth date or social security number, whatever it might be, it can be included in your search. As I search for Vicki, she's already a patient in our registry. If she wasn't already a patient, I can quickly add her into the registration. Now, you might notice that you do have to search the patient first before you're able to add them into the patient registration, and that's going to minimize duplicate patients. Now, if Vicki's registration was not already captured within the organization, I can quickly jump into this to be able to begin that registration. Now, you'll notice this does take me into a quick reg, but I can quickly flip into a full registration as well. The fields that you're seeing here are color-coded. The pink fields are going to be recommended, and the yellow fields are going to be required. Those fields can be set at the individual organization level. Now, of course, at this time, we want to make sure we have all the information for our patient, Vicki. But at this time, I'm just going to add in this address. Now, you'll notice here I've just typed in the beginning pieces of our patient's address. And next to that zip code, you'll notice an envelope icon, which allows me to run address validation. Address validation pings out versus the U.S. Postal Service to see if this is a real address. If we sent a piece of mail to it, would it be delivered or would it get returned? You'll notice that as soon as I check it, we were returned with a green check mark, which indicates this is a real address, and the remaining pieces of that patient's address have populated. Now at this time, we would want to get all of the additional details for our patient Vicki, but if you remember correctly, she was already a patient within our registration, and I can begin to search for her once again. Here I've located our patient within our registration. I'm going to select her to take us directly into the appointment screen. Now you'll notice here that all of the screens within Cerner Practice Management are customizable on a per user basis. I have mine set up in this 3-module format. Depending on how you like to review your patient's information, you can set it up accordingly. I know some people choose to have everything full screen with just multiple tabs across the top. Now before I add my patient's appointment here, I do want to call attention to the fact that I'm able to see how many times our patient has canceled as well as no-showed within our practice. I can also see any appointments this patient has within the organization scheduled. Along the right-hand side, I can see my patient's demographic information as well as health professional information. I do have the ability to link out to see a balance summary at this time. But I'm going to go ahead and begin to add this patient's appointment. Now she's coming in for an established visit. You'll notice as soon as I add that appointment type here that it's going to populate with any locations in which Dr. Reiling sees established patients. Next, I'll be presented with a list of visit reasons. This list flexes off of that appointment type. So we're going to say Vicki's coming in for some pain today. I also have the ability to add any additional time to our patient's appointments, add in a referring physician, which searches out through the NPI database for any provider, as well as associate a health insurance profile here. For instance, our patient might have a secondary or tertiary insurance, and we can associate a proper insurance to this visit. Now you might notice that it was so easy for me to schedule this appointment. Dr. Reiling had availability today, and Vicki Jaffer needed an appointment today. It might not always work out that easy in your practice. Maybe you're scheduling out a couple of weeks or even months in advance. We do have a couple options available. First is going to be utilizing our first available option. Within this option, we can say maybe Vicki tells me she can only come in Mondays, Wednesdays, and Fridays, and only in the AM. Here I can suggest times that work for both Dr. Reiling and Vicki. I also have the ability to schedule this appointment reoccurring. So maybe Vicki needs to come in once a week for the next 4 weeks. I can schedule all of those appointments at once. Before I schedule this appointment, I do want to call attention to the lower left-hand corner where you can see any notifications. These can be built on the patient level, so anytime this patient's record is pulled up, this notification appears. For instance, Vicki is a VIP in our organization. This information can present in the lower left-hand corner. That way it's not interrupted to your workflow, yet you still have this pertinent information. So we'll go ahead and schedule our appointments, and you'll notice that any appointment guidelines that are necessary for the appointment type can fire upon scheduling. So as I have Vicki on the phone, I need to remind her to bring in her most current medication list. And confirming off on this appointment, it's going to remind me that there is any other appointment scheduled that Vicki has within our organization, saying, are you sure you need to create another appointment for her? We're going to go ahead and add another one for Vicki. And as I come back over to the schedule screen here, I can see Vicki has been added to Dr. Reiling's schedule for the day. All right, so I'm going to talk a little bit about the scheduling cues within Cerner Practice Management before we proceed with Vicki's visit. Now, we do know that sometimes providers might want to block their schedule. Maybe a meeting came up or they needed to take an early lunch. If that happens, there is the ability to block a provider's schedule. We'll go ahead and block our schedule from 11 to 12. We're going to say the resource, so Dr. Reiling has requested this block. And as soon as I do that, you'll notice that there was 2 appointments there for the 11 o'clock hour. Both of them have fallen off of Dr. Reiling's schedule. Now, those appointments were not lost forever. They've actually rounded off to our reschedule appointments or our standby appointments. Any appointments that have displaced from the calendar will fall here so we can work through the rescheduling process. Now, say for instance, Dr. Reiling decided she no longer needed to take an early lunch and she wanted to cancel this block. If any of those appointments which were originally on the schedule have not been rescheduled, they will fall back in place. Now, looking at those same cues, I also wanted to call your attention to the standby appointment request queue. Now, we do know that from time to time a patient will call in asking for an appointment which we can't schedule at this time. Maybe the patient needs the appointment within the next couple of weeks, and there's just no time available on the provider's schedule. We can create a standby appointment request, so as time frees up from the calendar, we can know exactly who we should call. Notice here that there is a priority column, so as you are scheduling, maybe the patients who are severely ill or even VIP patients are going to be higher on the priority list. Alright, so let's catch back up with Vicki, who's now presented to the office. I'm going to move to my patient tracking board. On the patient tracking board, you'll notice here that I am viewing all the patients coming into Rock Creek Clinic, as well as all the patients that are just scheduled to Dr. Reiling. Now, if you're sitting at the front desk and you're checking in patients coming in from multiple providers, perhaps you would want to just look at the location view. If that's the case, there's probably a lot of patients on this list, and you can utilize the next 2 hours or the next 4 hours filters, so that way you're not pulling so much patient information. Now, you'll see here we do have that list of the patients who are coming into the practice today. This allows us to see what status those patients are in. Here we can see Vicki's information right here. We're able to see her glamour shot as well as any demographics and details on her insurance. And at this time, we're going to go ahead and check our patient in. Now, upon checking Vicki in, it is going to present us with a forced workflow. This first screen is going to be the modify a patient screen. So perhaps we didn't have a chance to confirm Vicki's demographic information when we had her on the phone. We do have the ability to, at this time, make any updates to her demographic information from here. You'll notice we have not confirmed her address through the validation process. Since it has not been completed, we are prompted to see if we want to do that at this time. Next, we are able to see some detailed insurance information. From here, we can actually submit out to eligibility. Now, keep in mind, this is a demonstration domain, so our patients aren't actually eligible. But right from here, you're able to submit out eligibility. I also wanted to call attention to the fact that you have the ability to run eligibility in batch mode as well as real time or a combination. A lot of our clients today will run eligibility in the beginning of the week for all the patients coming in. And then any patients that are scheduled in real time can run that eligibility on the fly. You'll also be able to see any eligibility details that come back, and that's going to determine what the financial responsibility is. So we'll say here that Vicki owes us $20 today. Now, as soon as I save off on that insurance information, we can see Vicki's visit has updated to $20 due today. Now, at this time, we're going to want to collect that money from her. Keep in mind, this $20 can be collected at the end of the visit if that's how you're currently doing that in your practice today. We're going to run a self-pay remittance. You'll notice that this has populated us into today's encounter, but we do have the ability to collect on any other encounters as well as a first in, first out basis. Now, we do know that Vicki is paying us $20 today. That is a patient payment. We also can collect multiple payments at this one time. We can collect this payment as credit card, check, cash. Vicky's a little old school. She's getting out her checkbook today, so we're going to collect that check from her. If we were collecting cash, it would require us to put in the amount tendered so we know what money comes in our drawer and what money leaves our drawer. Submitting off on this payment is going to present us with a receipt. This receipt can be printed for Vicky's records as well as our own. And now Vicky has been updated to that check-in status, and we can see that that $20 has been collected from her. At this time, we're going to switch gears, and we're going to sign in to the EMR to that home screen from the provider's perspective. Now, I've just signed in to the EMR. This is going to be the home screen upon signing in. You'll notice I am viewing patients just for Dr. Riling, but perhaps if I was a nurse or an MA who worked under multiple providers, I can multi-select in here, stack all of those appointments, one on top of the other, in sequential order. I also have the ability to see what patients are coming in today, as well as what they're coming in for. Now, this reason for a visit is going to populate from the scheduling, and the chief complaint is coming in from the nurse's chief complaint documentation on the intake form. Now, it's great to have both pieces of information there because then we can tell if that's changed from the time the patient was scheduled to when they actually present it to the clinic. We can also see what status these patients are in. Now, these statuses are automatically updated based on actions taken within the solutions. So as soon as Vicky was checked in from Cerner Practice Management, it automatically updated her status. It looks like this patient, David Allister, has already been seen by the nurse, and that actually was updated as soon as the nurse updated and signed off on the intake form. Now you'll notice that the statuses of the appointments link directly with the color indicators you see on the left-hand side. A few of those have the white light behind the color, and that's going to indicate to the provider that there's additional information that I need to capture from that visit that I have not done so yet. So if I hover over Ruby, I can see here that I haven't completed the visit charge or the notes. These are hyperlinks directly into Ruby's chart to complete this action. Now we know sometimes that we're waiting on a piece of information, such as maybe a lab result to come back before we want to sign off on our document. Not everything gets completed same day. In this case, anything that's outstanding is going to fall over to an Open Items tab. This tab is going to look back over the past week and capture everything that we still need to document for those past weeks of visits. Now this last view here is going to be our calendar view, which is allowing me to see what patients I have across the entire week. This allows you to see where you have breaks in your day. I also wanted to call attention to the left-hand side of your screen. This is a quick view into your message center. Now, the message center is used for inter-office communication between clinicians. You can also use the message center to communicate back and forth with your patients through the patient portal. And lastly, you can utilize the message center to communicate with outside providers utilizing Cerner Direct. Cerner Direct is embedded directly into the EMR, so as a provider, there's no additional portal that you need to manage outside of your EMR. Now, it looks like as a provider, we do have quite a bit of messages, orders, and documents to review. All of these are going to filter into your message center and have subcategories so you can easily organize what you should address first. Looking at my results, you'll notice these have been broken out into critical, normal, abnormal. We can see into our results here. It looks like there was a result that came back from one of my patients, which I want to address at this time. Now, looking at this result, we're able to see everything that came back from the panel, as well as have the ability to trend these results across time. Now, if we needed to take action on these results and communicate them over to our patient, we have a couple options. First is the ability to create a letter which can include current and previous results. In previewing this letter before it gets sent off to the patient, we can see exactly what information will be communicated. Now, of course, this is just one way to communicate this information. Additionally, we have the ability to send that exact same information to the patient's portal through a consumer message. Now, if the patient has signed up for the patient portal, this consumer message option will be available. Now, if I go back to my home screen, I can see our patient, David Allister, has been checked in and has been seen by the nurse. So I'm actually going to walk in the room, in David's exam room, just bringing in my iPad. Now, as I'm walking in the exam room with just my iPad, this is Cerner's native application, PowerChart Touch. It sits on the exact same platform as the desktop, so anything that's reviewed or documented from here is immediately accessible on the desktop. Now, you'll notice this has a very similar look and feel as this information looks on the desktop. On the left-hand side, we can see our schedule for the day, the same patients that we saw on the desktop. We can see this information in a day view where we're able to determine where we have breaks in our day, as well as a week view. Now, this week view, you'll notice it allows me to see how heavy my schedule is. Down below, looking at the calendar, you'll notice the bubbles underneath each date determine how busy the schedule is on a heat map basis. So the darker the color is going to indicate more patients at that time. The lighter the color is going to indicate less patients. Now let's go back into our schedule for the day. There we can see David Allister's information seen by nurse is coming in for a diabetes evaluation. And as I enter into his record, we can see that all of the information that was completed from the nursing intake has populated into the record. Looks like David's coming in for diabetes follow-up, as well as wanting to talk a little bit about his hypertension. We can also see any previous documentation on our patient. So face up, it is going to present me with the last note that I've completed on David, as well as any other previous notes that have been completed throughout the organization for this patient. Now, I do have the ability to look at all notes for this patient. At the top, you'll notice there are some filters, so maybe we wanted to look at just notes from the past 6 months, just notes from physicians, as well as only any notes coming from outpatient encounters. Now, you'll notice that my list has filtered appropriately. We can look into any of these documents, flip through, similar to how you would review a paper note, and then always have the ability to drill into a certain section. Also, if there's anything that I'm specifically searching through from a document, there's also the ability to search a note. Now, as I come back to the Review tab, you'll notice that the vitals and measurements have updated from the intake form. Any values that are outside of the normal reference range will show up in a color indicator. Orange is going to indicate slightly high, red, severely high, and blue being a low value. You can see that I am viewing this information in metric, but I can always flip over to see the same information in US measurements. I also have the ability to look at these results across time, trending them across time. And if I needed to see a graphical representation of these results, I can do so. Now, looking at David Allister, it looks like he does have quite a bit of information documented as far as blood pressure results go. Since this is a native application, I can utilize native iPad gestures to utilize pinching and squeezing to spread these results across time. I can also view a particular result from here. Now, looking at my problem list, these are the chronic issues that David is constantly being seen for. Now, we do know that he is coming in for a follow-up evaluation of his diabetes condition, as well as his hypertension. Just a swipe of my finger is going to convert those chronic issues into today's diagnosis. I also can add any additional orders. You'll notice there's a plus sign in the upper right-hand corner, which I can search for. So maybe David's also complaining of a sore throat. I can easily search for that diagnosis. You'll notice I didn't have to type in that phrase completely or correctly, and it is going to present me with a list of diagnoses that match my search criteria. Additionally, we can also see that ICD-9 code included in here. Now we're reviewing the rest of my patient's chart. I can see any allergies. Any severe allergies are going to show up in the red color. We can also see any lab results, and these lab results can be trended across time as well as graphed, similar to what we saw with the vitals and measurements. Looks like David's cholesterol is spiking and then falling. We can also see any diagnostic reports through here, as well as the immunization history and historical information. Now, looking at my patient's historical information, we can see that David was a former smoker, but we can also see any family history and procedure history. Now, at the bottom of my screen, you'll notice that there is a place for me to begin my documentation. Now, this utilizes a voice recognition software that's built directly into the application. This voice recognition software requires zero training. So if any of you have utilized a voice recognition software in the past, you probably remember a time period where you needed to train it to capture your dictation and any accents you might have or dialect. This requires zero training, so you can literally pick up your iPad out of the box and begin dictating. So we're going to go ahead and capture this visit documentation. The patient is a 73-year-old male presenting for a follow-up evaluation of diabetes and hypertension, period. Patient sugars are slightly elevated but improving, period. He states no hyperglycemic episodes in the last 6 months, period. Conditions are controlled with medication, but experiences some compliance issues with diet and exercise, period. Next field. Insert normal review of systems. Next field. Insert normal physical exam. Save documentation. Stop listening. Alright, so we just saw a couple of different forms of documentation. Of course, you can utilize the voice recognition software to dictate in, similar to how you would utilize a dictaphone. You also saw me add in a couple of commands that charted entire sections for me. Now, what's great about that is those commands are built at the individual provider level. So each individual provider can create templates, have them saved for themselves. That way, as you're dictating, your review of systems might look different than your colleagues' normal review of systems. Now, if anything is out of the ordinary or needs to be changed, I can simply tap in, utilize phrases such as scratch that or delete that. It's going to remove off that text, and I can redictate in what that should be. Now at this time, my documentation is as I want it, and I'm going to move over to that Orders tab. Now this is going to show me any active orders my patient has currently. Looks like my patient's on a couple of different medications, and on the right-hand side we can see real-time information coming from SureScripts showing me if these medications have been refilled or if there's any refills remaining. It looks like my patient's Lipitor is running out of refills. So with a swipe of my finger, I can easily refill this medication. Now this is going to show me any of those details coming back from this med sig. You'll also notice that it is going to pull it through the normal interaction. So it looks like there's a clinical interaction here. I can use my best clinical judgment and override this alert. I can also make any changes to the medication details if needed. Perhaps I wanted to give David one refill on this medication this time. I also can see any preferred pharmacies David chooses to go to. So it looks like he has 4 different pharmacies he likes to go to. I'm sure one's near his home, maybe one's near his work, and so on. But today he is feeling choosy, doesn't want to go to any of these pharmacies. We can easily link into maps to be able to locate any additional pharmacies near David's home. Now there is filtering criteria within here, so if we maybe wanted to see just pharmacies that were listed for 24 hours, we can filter out any other pharmacies. We also can search for pharmacies based off of mail order pharmacies. Now, once we have our pharmacy selected, we can easily sign off on this medication. But before I do that, there are a couple other orders which I want to place. You'll notice in the upper right-hand corner there is a plus sign which allows me to add any additional orders. Now this list that you're seeing presented here is labeled frequent orders, and it's labeled frequent orders for a reason. This is my individual top 25 most commonly placed medication list. This is not something I need to manage or maintain. The system gets to know me as a provider, understands what I'm commonly placing, and is going to maintain this list for me. So it's saying, here's what you're always placing. Do you want to just add one of these medications? Now also I have the ability to search the entire order catalog. Perhaps maybe I needed to add a lab for my patients. I can search for it. I can also add any diagnostic tests, maybe any communication orders, or even any charges from within here. So I'm going to go ahead and refer my patient over to endocrinology. Now at this time, there's one additional detail here. It's looking for a reason for exam for that referral. I'm going to go ahead and notate that that reason for the referral is to the patient's diabetes. We get one last final look at these orders before I sign off on them. And now they're all routing to the appropriate location. So that medication's going directly over to David's preferred pharmacy. That lab is sitting on that patient's record waiting to be completed. And that referral is going back into the practice management solution so that way it can get scheduled. Now at this time I've completed my documentation, added orders. I can quickly go over to that document tab where it allows me to choose a template and pulls everything that's been completed during this visit into my notes. Now my note is not complete at this time, so if there's any by the ways that I need to document or make any changes to what I've already completed, I can do so from here. Now at the bottom of the note, we are going to be able to see our diagnoses from today's visit and have a place to add the plan in. Now of course this plan can be dictated in, it also can be typed or even have a command built out for common plans. I'm going to go ahead and add this now. I have spoken with the patient about the importance of taking medications as directed, eating a balanced diet, and exercising regularly, period. Alright, so at this time my note is truly complete. In the upper right hand corner we can sign off on that note. Now before I do that, I'm actually going to take this visit, not sign my note from the iPad, and I'm going to pull us into the desktop so you can see how we would view the same patient's record on the desktop. Now you'll notice I've come right back into the EMR here. This is that home screen that we saw earlier. I'm going to drill directly into David's record. Now you'll notice as soon as I come into David's chart here, we are viewing the clinic workflow tab. This is going to show me along the left-hand side all of the pieces of information that we'll be reviewing and documenting during this visit. Now taking a look on the left-hand side, the majority of those components we've already reviewed and documented while we were visiting with David in the office on PowerChart Touch. Now this is customizable on a per user basis, so each individual provider can determine how they like to review their patients. Perhaps maybe I like to start every single visit by reviewing my patient's vital signs. I can move that to the top, and that's going to save as my preference so I can easily see that as soon as I walk in the room. Now you'll also notice on the left-hand side there is the ability to choose which components are shown here. Now I'm going to sit down with David and review the rest of his chart here. I can see that chief complaint, any previous notes documented, and filter these notes. Maybe I wanted to look at just my notes or even have a filter set up. As I'm looking at this, I can pull open a note here, be able to read exactly what happened on our previous visits. I can also review any labs. Any labs showing up here can be viewed as well as any diagnostics. Historical information and problems. These problems have already been recorded for this visit. And next we're able to see that HPI review of systems and physical examination. This is the exact same information that we documented when we were on PowerChart Touch. I can also review any home medications from here and take action. So for instance, maybe I needed to renew my patient's medication for Crestor, I can do so. Renewing any medications is allowing me to also change any of those med details. So if I needed to add a couple refills, I can do the exact same action, very similar to how we renewed medications on the iPad. Now additionally, I have the ability to place any new orders right here from my workflow. This is going to allow me to utilize any folder structure I have in place or my favorite folders. But I also wanted to call attention to the ability to place orders on a quick orders view. Now this quick orders page was designed to look very similar to a paper super bill. Our providers told us the one thing they missed going from paper to electronic was this paper super bill. It was so easy just to check, and the orders are complete, so we developed an electronic version. You'll notice that this is specialty specific, so depending on what specialty you are, you can have a view which presents you with the most common orders for that specialty. Now as I'm looking at this, I can easily add any orders, maybe a follow-up, maybe I also need an A1C. And all of the orders have routed up to my orders for signature, almost like your shopping cart. Now I can easily associate a diagnosis with each of these orders, and at this time maybe I made a mistake and I didn't mean to add that diagnostic test. I can remove it at this time. Now all of these orders are going to sign and route to the appropriate location, so that follow-up is going into the practice management solution. So as soon as David checks out, that next visit can be scheduled. Looks like this A1C does require an additional detail here. I'm going to go ahead and fill that out. Any of those details will be prompted to you, so it's not like you can sign off and miss any of those required details. Now my orders are complete, but there's one additional thing I wanted to talk about, and that's the ability to add a plan or order set. So I'm going to go ahead and search for a diabetes management plan. Now these plans are built on the individual organization. There are several that Cerner already have available. And right here we can actually see that this order set includes multiple types of orders. These order sets can also be built to automatically have orders checked and then give the option to the provider whether they need to select any additional orders. Now upon initiating this order set, it is going to tell you exactly which orders you've selected and allow you to sign off on these all at once. I'm going to go back to that workflow screen here and take everything that we reviewed and documented during this visit and pull it into my notes. Now keep in mind this is multi-contributal. Some of the work was completed by my nurse and some by myself. And as soon as I open up this note, you'll notice that it is in a 2-column format. Everything documented on the left-hand side is going to be from today's visit, and everything documented on the right-hand side is that ongoing clinical information from this patient's chart. Now, the reason for this 2-column visit is our providers who are utilizing the solution today told us that the first thing they do when they review a patient's note is scroll all the way to the bottom because the information they're interested in is that assessment and plan. This 2-column format allows us to really maximize the screen real estate. Now I can put that personal touch on my note from here, once again adding in that plan of action. So I do have a diabetes plan. I think I also have a hypertension plan for all of my hypertensive patients. And now at this time I also have the ability to maybe distinguish exactly what we covered during this visit versus what pulled in from my patient's medical record. So in the upper left-hand corner, there's quite a bit of chronic issues that are listed there, and most of them we did not address during this visit. I can remove these at the item level as opposed to the section level, so I'm truly just signing off on what we covered during this visit. Now those problems don't remove from my patient's problem list, it just removes from my notes. Now I'll go ahead and sign off on this document. If I do need to request an endorsement, I can fill that out there. next, Cerner's computerized assisted coding tool is going to run and help me code for this visit. This utilizes Cerner's natural language processor, and it'll first ask me a couple of questions about this visit. I'm going to say this was an established patient, and I believe it's a level 2 visit. Next, ENCODE is reading through this note just the same as what a biller or a coder would do. You'll see in the upper left-hand corner there's that 99212 that I just suggested, and directly below it, ENCODE says, I have enough documented to code for level 4. Now you'll notice this level 4 is a hyperlink, which we wouldn't expect our providers to dive into every single visit, but it is nice to note that the information of how ENCODE came up with that value sits behind here, so if we ever need to see how ENCODE came up with it, we can see. On the left-hand side, it is pulling out all the pertinent positives and pertinent negatives off of the document we just signed off on. And on the left-hand side, we can see each section of the note and the associated point values. Now, a couple of things that I wanted to point out about this document. Cerner's ENCODE has the ability to read through any type of document, no matter how it was created. So whether you use a little bit of structure, you use a little bit of templates or free text or dictation, no matter how you document it, Cerner is able to read through that document and code appropriately using ENCODE. Now the next thing I wanted to point out, in the upper left-hand corner, you'll notice there's that ICD-9 codes for today's visit. Directly below it, we can see ENCODE pulled out some ICD-10 codes. Now we all know that this October 2015 looks like the United States is going to jump on board with the rest of the world and switch to ICD-10. Now, you may or may not know, but Cerner is a global company and have been utilizing ICD-10 in other countries for years. So once the United States decides to jump on board, we're ready to not only capture those codes within our solution, but we also have tools that we will provide to the end users to make sure that they're coding appropriately. Now, I can choose to go with my original 99212 or ENCODE generated 99214 or a brand new code. It will never force me into a particular level of coding. Now, down below, we can see any diagnoses that were pulled out from my documentation. And I can associate that diagnosis code to my charge for today. And that's immediately going back into Cerner Practice Management to begin that claims processing. All right, so now my visit with David is complete, but we know that we are going to refer a patient over to an endocrinologist. If we were just going to refer a patient to an endocrinologist in-house, of course, that's so easy. You saw me place that order. That communication goes over to scheduling to complete that request. What if we were going to refer outside of our organization? We can easily utilize a provider letter. Now, the provider allows us to see any providers who have relationships with our patients, and we can do an internal or external search to find any additional providers. Now, I'm going to do an external search out to a provider outside of my organization, Dr. Machodo. Searching for him, it is going to utilize the NPI database looking for any provider. Now, you know that I am signed in as a provider at this time. If I don't want to complete this entire action of creating the letter, I can forward this on to someone else within my organization to complete. Maybe I'm feeling ambitious today and want to do it myself. I can easily browse through any documents. Looking at the last note that I just signed off on, of course, I can't attach this full document here, but I know that Dr. Machodo is very busy, maybe doesn't want to read through my entire notes. I might want to attach just one simple section here. I also can add any results to my letter, so maybe there was a raised blood pressure or that CBC was completed and I wanted to attach those results. But at this time, I can easily preview this letter as it stands, and this is exactly what Dr. Machodo would be seeing. Now, when you think about sending information from provider to provider regarding a visit that you have with a patient, typically, if you forward that note or you faxed it, it would print out in about 6 or 7 pages. And usually only the first and last page are usable and the rest get thrown to the wayside. Right here, Dr. Machodo is able to see everything he needs to. in a simple one-page letter. All right, so as we're saying goodbye to David, of course, there's always that, oh, by the way, at the very end of the visit, right as your hand is on the doorknob, David says to me, hey, Doc, do you remember that time when I had that pain in my arm? I don't really remember much about it, how I got it, how you treated me, when it was, but I do remember describing it as being struck by lightning. I'm going to quickly utilize chart search for struck here, and we can see just as easy as that, I'm able to locate that note in which a provider, not even myself, it was Dr. O'Neill, created this note where it says David described the pain being struck by lightning in his right arm. And this was documented over 6 years ago. I'm able to pull open this note, see exactly what was included and how I treated this pain. Now, of course, this is just one way to utilize chart search. You also have the ability to search for a term and find any related concepts. So we know that David is diabetic. I can easily search for diabetes within here. Not only is it going to show me anytime the word diabetes was documented, but any related concepts such as any medications related to diabetes, any A1Cs or glucose levels, any sugar levels. We can see if there's a foot ulcer within here. And on the left-hand side, we do have the ability to filter this information down. Now, some providers choose to utilize this as almost a plan of care for their patients. We do know that all diabetics need to have their A1C documented once a year. If I filter down this last year and I'm not seeing an A1C result, then I would know to go ahead and get that order today. Now, of course, this is just one way to be able to search through your patient's record, looking for that needle in the haystack, but what about your entire population? We do know that it's difficult to manage your entire population, especially when they're not always sitting right in front of you in the exam room. Cerner developed a tool called the Dynamic Work List, allowing you to create work lists or reports on the fly. You'll notice that I do have several different work lists already created, which I can toggle between. This first one in particular is just a simple list of all of my diabetic patients. Now, looking at this list, you'll notice on the left-hand side there are several different filtering functionality. Now, I might not be concerned with my entire diabetic population. Maybe I'm just wanting to find and locate those diabetics who have had a A1C resulted. Not just any A1C, but an A1C that's been documented as greater than or equal to 6%. You'll notice that my original list of 29 patients has now filtered down to just 15 patients. Additionally, we could also see any medications this patient's on. So this brings up a good point of how do you easily find out a list of all of your patients who are taking a certain medication if that medication is recalled. Well, the Dynamic Work List is great for that, and we know several of our clients are utilizing this today for that functionality. So let's go ahead and see all the patients that are taking lisinopril. Now here you'll notice that this list has now filtered down once again to just 9 patients. Now you'll notice here that we can also take into consideration any of those health maintenance expectations. Now those health maintenance expectations are documented on the patient's record based off of the U.S. Preventative Task Force guidelines. So let's see all of those same patients who are due for their urine dipstick. Now once again, this list has been filtered just down to those 8 of the original 29 patients. Now taking a look on the right-hand side, we can see a list of all those patients. We also have some great information from here, such as what primary care physicians are associated with these patients, any additional conditions that patient has outside of diabetes, what insurance that patient has, as well as how many times has that patient come in for visits in the past 180 days. So it looks like David must be a hypochondriac. He's been to the clinic 172 times out of the 180 days. Now we do have the ability to take a peek inside David's chart without actually leaving the dynamic work list. Right from here, we can catch up with our patient. Say, for instance, we haven't seen David in a while. We might want to see what other medications have been administered for our patients. We might also want to see any labs that have been recently documented on this patient. Now, of course, this page is also actionable, so if we wanted to send a message, we could send a message maybe to someone over in scheduling saying, hey, can you please reach out to David? He needs to see it. We need to see him again in the office. Or we could send that exact same message to David, which would go to his portal. He can utilize the scheduling portion of the portal to add that appointment. Now, additionally, there is a quick pick list of assessments here, which we could easily document for a list of patients. So if you needed a way to quickly assess those patients, this is available. Now, we have talked a lot about how you're able to filter a list that's already in existence and manage those patients, but I do want to point out that the ability to create a list is right here. Now, as you do create that list, as you have your criteria set, your list is viewable in real time. So when you're thinking about how you're currently receiving reports, maybe you're asking an IT person or maybe an office manager, and maybe that list gets returned to you in a day or two. But right from here, you're able to easily see that information at your fingertips as you request it. And then you also have the ability to share a list, so maybe someone within your practice creates it, and it can be shared amongst all the providers, as well as have the ability to export a list to a PDF or Excel spreadsheet. And additionally, there is the ability to import lists as well, so perhaps maybe a payer sends you a list of patients on a PDF, and you need to manage those patients for a certain criteria or condition. You can import that list. That way you can manage it right from your dynamic work list and have quick links into the patient's chart. Now, as we are talking about quick links into the patient's chart, let's go back into David Allister's chart just one last time. I want to talk about those health maintenance guidelines. Now, you'll notice that this sits on the workflow page as well, so we can see exactly what our patient is due or overdue for. It looks like David is overdue for his foot exam and that A1C. You can see exactly when the last time each of these results were satisfied. So that way, as he is in the office today, we might want to take note of this information and make sure that he's staying up to date. Now at this time, I would quickly go back to that home screen here where I'm able to see my next patient who's checked in and ready to be seen. But we're actually going to flip gears once again, go back into the practice management solution, and be able to see that checkout process. So once again, we're back here in Cerner Practice Management on our patient tracking screen. David is walking out right now, so we're going to go ahead and get him checked out. We can easily check out this patient, which is going to update everybody that David has been checked out and is leaving. Now, looking at David's information, we do see an exclamation point next to his name. And this is actually an indicator that something was added during this visit that we need to follow up on. So as we select this, we're able to see any future appointments which were just added. So we can see it looks like Dr. Riling did place a future order for our patient today. I can easily open up this patient. It's going to take me to that appointment screen, which we're very familiar with. But this time it's going to open up to that future appointment request tab. Now, as we do see this request coming back from Dr. Riling, I can easily complete this request. It's going to take all of the fields which were documented from Dr. Riling, put it into my appointment here where I can easily utilize that first available option to get this scheduled. Now, if we don't have time to address this follow-up appointment from the checkout screen here, it's not going to get missed, rest assured. Once again, we can utilize these cues to show any future appointment requests coming back from the providers. So here we can see David Allister. Once again, completing this request will take us directly into that future appointment request, into that same look and feel. So there's two ways to be able to track this information. Now at this time, I'd like to jump directly into David Allister's record from today into his patient account information. Now as I open up David Allister's patient account information, it has drilled me down directly into today's encounter. Once again, these screens are customizable per user, so we can see I have the encounter information listed above, and I can easily see patient account information. Now down below, we can see any charges which were captured during the visit today. So it looks like for right now, we're just seeing that office visit level 4, in which case in our practice, we charge $110 for. Now in my balances tab, it looks like we can see that $20 we collected in the beginning of the visit as a copay. And with Cerner Practice Management, the entire claims process and remittance coming back in is all an automatic process. So at this time, of course, we've looked at the charges that have come back. What would actually happen in a real practice is in a batch mode, it would take all of the claims which are ready to go, run them through the scrubbers, and anything that was clean and ready to go out is going to automatically go out in batch mode. Now anything that hit the scrubber and failed is going to go back into a work queue, which can be followed up on, and I'll show you that queue in just a bit. Now as those claims go out the door, same thing happens electronically and automatically. Those remittances are going to come back in. Those remittances are also going to have that unique claim identification number, so that way you can easily track it. The remaining balance, that's automatically going to go to the secondary or tertiary insurance, however you have those rules set up, or roll to a patient statement. Now, any statements which have been added for this encounter are going to be listed on the Statements tab, where we're able to see this information at any time. So if your patient does call in asking questions about a particular statement that they're seeing at home, you can pull up exactly what they're seeing at home. Now, included on the statement can be an access code where the patient can go to pay their bill online. Now, I did talk a little bit about the fact that if any of those claims hit that scrubber and fail, it is going to run into a work queue. I'm going to go over my workflow tab so you can see how you would actually be utilizing Cerner Practice Management from a patient accounting standpoint day to day. So this is the workflow page. You'll notice that I am signed in and I have 2 employees who work underneath me. Now looking at this, I'm able to view into their particular queues that they have work assigned. Now from this point, I'm able to see all of the work that they're associated. It looks like this particular employee, Kathy McGinnis, she has a lot of patients in the in-house queue that she's working through, or a lot of accounts. If need be, I can always go in and redistribute her work. Now keep in mind that you can give privileges to who's able to redistribute. Additionally, maybe one of my staff members was going on vacation for a while, I can redistribute the work amongst multiple staff members and redistribute it evenly. Now looking at all of the queues that Kathy has over here on the right hand side, of course if we needed to go in and look at any of them, keep in mind that some of these are more focused on the inpatient side, but they are all going to be appropriate for your organization. We can easily see which account she's working through that are ready to bill. For this particular patient, I can launch into their record. It is going to show me the encounter information as well as the balances. I can see down here that this patient is ready to bill. And if I need to apply an action code for this patient, I can do so. Perhaps maybe I needed to say that we should call back on this account. I also can determine a time frame. So maybe I needed to call back in a day or maybe just an hour, and also add in a comment. So maybe I needed to say, called the patient. Now, as I do apply this action code, this particular count is going to fall off of my list at this time, and it will populate back up in an hour. From here, I can easily move right back down to the next patient in this queue, so I don't have to disrupt my workflow. I can move from patient to patient. Now I'm going to go back to my work queues here. And you might have noticed on the left-hand side that I do have a list of reports. Now these reports are particular to this staff member, Kathy McGinnis. She has it set up so that her reports automatically populate into her workflow tab. That way she doesn't have to start every morning by running reports. Now these will automatically populate in here so she can review in the beginning of the day. And you'll also notice that there is a purge date. So at the end of a certain time frame, they are going to purge. That way she doesn't have to manually do that herself. Now outside of these reports that you're seeing right here from Kathy's view, Cerner does have a whole other list of reports that can be run: financial, patient accounting, any type of PM, as well as any type of clinical reports. So at this point, this concludes our demonstration of Cerner's ambulatory solutions. We've just covered the front office Cerner practice management, the EMR from the provider's perspective, utilizing both a mobile application as well as the desktop version, and concluded with some patient accounting piece. I want to thank you for your time today.